Hi and welcome to this short video discussion on important formulae for Neetpg. We have total of 60 to 70 formulas which are most important in your exam, but in this video we are going to discuss the most important 15 important formulas for Neetpg. So the first formula based question comes from the topic of Inthavan's law. So Inthavan's law states that the potential of first and the third lead is equal to the potential of second lead. So based on this you can have a numerical question. Second formula is based on Bezet's formula. Bezet's formula gives you corrected QT interval from QT interval divided by square root of RR interval. Third formula based question is on oxygen carrying capacity, which is given by 1.31, that is the Hafner's constant, into hemoglobin level of the patient into the oxygen saturation of the patient. Fourth formula based question comes on total blood volume, which is given as plasma volume divided by 1 minus hematocrit. The fifth formula is based on your corrected reticulocyte count, which is given as reticulocyte count into the hemoglobin of patient divided by 15, and your reticulocyte index is your corrected reticulocyte count divided by maturation factor. The sixth formula is based on gain, which is given as correction divided by error. Seventh formula is a biochemical formula, which is Friswell's formula. This is for calculation of LDL. So LDL is given as total cholesterol minus HDL, and it should be minus VLDL, but since we are calculating VLDL in forms of triglyceride based on the question, so it is given as triglycerides by 5, and the maximum limit for triglycerides in the value should be less than 400 milligram per dl. The eighth formula is based on calculation of ejection fraction, and it is given as stroke volume divided by end diastolic volume, that is end diastolic volume minus end systolic volume is stroke volume divided by end diastolic volume. Ninth formula based question is on the biostat, and it is it is calculation of mode in asymmetrical distribution or a bimodal distribution. So mode in asymmetrical distribution is calculated by 3 into median minus 2 into mean. The 10th formula based question comes on serum osmolality, which is given by the formula 2 into sodium plus glucose by 18 plus BUN, that is blood urea nitrogen, divided by 2.8. 11th formula based question is on shock index and modified shock index. Shock index is heart rate divided by systolic blood pressure, whereas modified shock index is heart rate divided by mean arterial pressure. 12th formula based question is for calculation of your intelligent quotient, and it is calculated by mental age divided by chronological age into 100, and here the important point is the chronological age can be maximum of 15. 13th formula based question is based on degree of freedom in chi-square test calculation. So it is given by number of rows minus 1 into number of columns minus 1. Okay. 14th formula based question is on tetanizing frequency. It is given by 1 upon contraction period. And the last formula based question of this video is calculation of Maddreys score or discriminant fraction. It is done in patients with chronic liver disease. It is given by the formula of 4.6 into prothrombin time of patient by control in seconds plus serum bilirubin level, and the significance of Maddreys score or discriminant fraction is that when it is more than 32, which signifies a severe disease, we start glucocorticoid. So this has a therapeutic value. Thank you.